Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I'm interviewing Rick Olderman, who is a physical therapist. I am asking him questions from our audience that you guys submitted about leg pain issues, including hip, knee, and ankle, and different foot issues. So, without further ado, here's Rick. All right, next question. We're going to combine two again because your answer is kind of similar for both. So, from YouTube, SG says, I am a keen runner and do supinate when I run. I have had recurrent inner knee pain near my gracilis muscle, preceded by tenderness in the area before medial knee pain occurs, almost at the joint, bony area where the knee bends. What is the best approach to dealing with this? I have tried to focus much of my strength, much of my regular strength work on my hips, my glutes, but so far I'm not finding this to help out with these issues. Is there something more effective I could be doing? And the next question, which is similar, is Nicholas B. I have runner's knee. The swelling comes and goes. Help me understand the pathophysiology and how can I rehab best, please?
Yeah. So let's go to the first guy's question. So there may be a red herring in there. So he first mentioned supination. Supination means that the arch of the foot is high. Okay. Was this a guy that
It
that
it, it says SG. I
SD?
haven't
Okay.
seen their pictures. I don't know.
All right. All right. So first of all, we don't know their running style. Are they a forefoot striker? Are they a heel striker? A midfoot striker? Supination with any of these strike patterns has different ramifications. So when you're a forefoot striker, when you're running, you're naturally going to land in a supinated position, and then you roll into the big toe. So this is a normal pattern for forefoot runners. So I'm not sure if that may or may not even be an issue for you. If you're a heel striker and you're supinating, then that may be more of an issue because what that's doing is locking. When you strike with a supinated foot, you tend to lock the whole system up. All right. So, so one of the things that causes people to supinate. So supination is kind of a rare natural issue. Really, it's often a behavioral response to something going on in our bodies. So our thigh bones here are not all shaped the same. And some thigh bones are rotated out, in which case that's called femoral retroversion. And some thigh bones are rotated in, and that's called femoral anteversion. Men typically tend towards the femoral retroversion or external rotation of the thigh bone, and females tend to orient to anteversion or internal rotation of the thigh bones. So, if this is the consequence of this is that if your thigh bone is rotated out and you believe that you should be standing with your foot pointed forward, then you're going to likely develop a high arch. Why? Or a supinated arch. Why? Because you can't change the shape of your thigh bone. So your body is trying to rotate the thigh bone out. You're forcing it to be in by pointing your foot forward. But those forces that the thigh bone are generating have to go somewhere. So what they do is they gradually travel spirally through the leg and cause the arch of the foot to raise in what appears to be a supinated foot. Almost all supinated feet I've looked at, though, have a retroversion where the person is trying to stand with their foot forward. When I get them to rotate their foot out slightly to accommodate the rotation of their thigh bone, then the arch starts to melt back down to the ground and they suddenly have a more natural arch. So your supination may be due to the fact that you have retroverted femurs and you're standing and running, trying to stand and run with your toe pointed forward, which is artificially causing a supinated foot. That would be my suspicion. All right. So, and then Mike, where was the pain that they were? So that addresses the supination aspect of things. So what was their pain in that first question, Mike?
Near my gracilis muscle.
Okay. So the gracilis muscle. All right. So the gracilis muscle is one that runs along the inside of the thigh and attaches into the lower leg bone. So why might that gracilis muscle first, be irritated? Well, first of all, why is it one leg and not both legs? And is it one foot that's supinated and not both feet supinated? So this leads me to think that there is a strength imbalance between your two legs if one problem is happening in one leg versus the other. 80 to 90% of the cases where that gracilis is painful is the weaker leg. All right. However, 10 to 20% of the cases, this leg is compensating for the other leg that's weak. Here's a quick and easy way to figure this out. Sit in a chair, lift up one of your feet, stand up and sit down, and then do that with your other foot on the ground instead. And you should notice probably a significant difference between the two legs. If it's the same leg that you're having pain in, then that leg is the weaker one. However, if the other leg is the weaker one, then that's telling you that you're likely compensating for some problems in that other leg during your running instead. Okay, so let's go back to this idea. This person has supinated feet and he has inner thigh tension and the gracilis. It doesn't matter which of the inner thigh muscles he has pain in it because they're all, they all basically do the same thing. So, why would this develop? Well, if we go back to the idea that he has a retroverted femur, and he turns his foot, or she turns their foot in facing forward, what muscles are they using to turn their foot inward? They're using their inner thigh muscles. So the more that they keep trying to turn their foot in, the more activated these inner thigh muscles become. And then you're running on them, and now you've developed a tendonitis issue on any of these inner thigh muscles. Frankly, one of those inner thigh muscles attaches right next to one of the hamstring muscles. And so a lot of people mistake a hamstring chronic strain when it's actually an inner thigh chronic strain. And the inner thigh chronic strain is occurring often because of this orientation of how they're orienting the lower leg in relationship to the shape of the thigh bone. So that's probably, if you just start turning your feet out, see if that gracilis pain goes away. If it does, it's likely further evidence that you are trying to excessively internally rotate that leg because you've got a retroverted femur.
That's not easy to do. I'm trying to do that.
Do what?
Let my toes go out because my toes are
Yeah.
naturally retroverted and they don't want to. When I run, because I'm kind of mid or front forefoot, they kind of want to just go straight when I land.
You're absolutely right. If you're a 4-foot runner, that's what happens. If you're not a 4-foot runner, then likely, and you're right, running is more difficult to turn the feet slightly outward than it is walking. So, however, we walk much more often than we run. So if you fix your gait pattern of walking, this will usually solve your running problems because your walking will have calmed down the muscles that are already irritated when you begin your running bout. So if you fix the issues walking, you won't have to worry so much about the running issues anymore. Those will melt away.
Sure.
Good point.
So when that comes, so that would pertain to runner's knee as well, fixing those type of issues?
Absolutely. Runner's knee, again, you could be compensating for weakness on the other side. So first test I would do, and I do this with all the runners during my initial exam, I have them do a single leg stand and sit down on one leg versus the other. And then if it's the same leg, then I know that that's the leg I should be focusing on. If it's the opposite leg, then I say, I think we've got a compensation pattern going on here. And so we dig deeper into that, where that weakness is.
Sure.
So, and again, the runner's knee, gosh, there's so much that could be causing runner's knee. Because think about the knee, then there's precious little in the knee that actually controls the knee. There's only that tiny little popliteus muscle that runs in the back. Everything else is coming down from the hip or coming up from the foot and ankle. So really, most runner's knee is due to some problem at the hip or the foot or both. And so, that's how you would generally think about it. Now, if you want to, you can try that little popliteus massage that I mentioned earlier. The popliteus runs across the back of the knee joint like this, from the lower inner knee to the upper thigh bone on the outside. Massaging that will untwist the knee and therefore allow it to move more freely. That alone might solve your runner's knee issue. If the popliteus solves it, well, you have to address then why the popliteus is so irritated. Usually it's because you're locking the knee all day long when you're standing. and walking. So you got to stop that behavior. The other component, and this is surprisingly, a lot of practitioners don't understand the concept of retroversion and anteversion in terms of the thigh bone. And so you could have a retroverted or anteverted thigh bone that's causing that your muscles aren't supporting correctly, which is causing stress at the knee because either the bone is excessively inwardly rotated and your butt isn't strong enough to control that internal rotation to decelerate it, or you've got it externally rotated and your foot isn't in the right place and are oriented in the right direction, and then that's causing torque at the knee too. But there's usually precious little at the knee that's causing knee pain. It's usually coming from a hip or a foot or both.